Let me thank the technical team of the National Council on Health, who've been led by the Permanent Secretary of Federal Ministry of Health and Social Welfare, Dr. Kashono and I, for the diligent work during the technical session, which laid the solid foundation for this council meeting. God bless you all and your team for the service to our country. Thank you for your attention, and God bless the Federal Republic of Nigeria.
Thank you, Dr. Isiaq Adebule Salako, Honorable Minister of State, Health and Social Welfare. Thank you. When in 2023, the government of President Bola Ahmed Tinubu came into office, and decision was being made on who are these people that will help Mr. President to achieve his objectives, particularly in the health sector, because of what we had on the ground, and the need to turn the health sector around as fast and as soon as possible. The president went far and wide, and the person that the search concentrated on was a distinguished medical practitioner, an administrator by excellence, somebody who has taken health care outside Nigeria working for international organizations. And the belief was that we need not search any further to ask somebody in charge of our health care in Nigeria. Therefore, the president decided that the ministry was not just going to be called Ministry of Health and Social Welfare, but that the minister that will come in will be given the responsibility of coordinating all the health issues. That means across the federation. Of course, that person is no other but Professor Muhammad Abipati, Commander of the Order of the Niger, who for a year, some months now, have been piloting our health sector. And we have seen developments in leads and values. Distinguished ladies and gentlemen, can I ask you to give a round of applause as I invite the coordinating minister of Health and Social Welfare, Professor Mohammed Abipati, to kindly.
His Excellency, the Executive Governor of Borno State, Professor Babagana Umar Zulu, CON, my brother, the Honorable Minister of State for Health, Dr. Isiaq Salako, the members of the National Assembly here present, Chairman of the committee, our Royal Fathers, His Royal Highness, the Sheikh of Borno here, very ably represented, His Royal Majesty, Sheikh of Bikwa, Sheikh of Bama, His Royal Highness, the Sheikh of Askira, Sheikh of Biu, as well as the Waziri of Borno, the Special Advisor to His Excellency Mr. President, my own sister who is here, Dr. Salma Anas, and the Special Advisor to Mr. President, my other sister, Dr. Jude Korocha, the Honorable Commissioner of Health of Borno State, Chair of the Commissioners Forum, and all Honorable Commissioners of Health, my own dear sister, the Permanent Secretary of the Federal Ministry of Health, the heads of federal agencies that are here, chief executive officers, the permanent secretaries from all the states, and their directors and the directors of the Federal Ministry of Health who are here, our respected development partners from far and wide. I see many that we spend a lot of time in Abuja, but I see some that are also coming from far away places. I see Caroline Linde from Norway, who came all the way just for this National Council of Health, and several others in the audience, represented by the Development Partners Group, respected civil society organizations, private sector leaders, members of the press, may I claim your indulgence to stand on the protocol. It was very heavily laid down by my dear brother, Minister of State for Health. Good afternoon to you all. I think the Honourable Minister's remarks laid out a very compelling narrative for why we're here, where we have been, and where we need to go. I want to start my own remarks by appreciating His Excellency the Governor, the Commissioner, and the entire people of Borno State, the government of Borno State, for the warm welcome, for agreeing to host us at this 65th National Council on Health holding here in Maiduguri. Your Excellency, we appreciate your commitment, your diligence, your partnership, and the fact that you arrived in Abuja at 8 a.m. this morning just to be able to be here. We don't take it for granted. The people's interests at the heart of your staff and your mind and your space. We really appreciate you and the amazing team that you have put in, as well as the Commissioner of Health and the entire team that have been able to make our visit here to Borno very smooth. And especially coming out of the flooding incident and the resilience that you have shown and the people of Borno State have shown. I also would like to thank our Commissioners of Health for their partnership over the last 1 year since the last council in Ekiti, and all the work that we have been doing together. And the permanent secretaries and technical group that spent days, hours preparing for the council, but also the technical sessions going through the joint annual review, the memos that are going to be presented today at council. So I thank you and all your teams that have done justice to what we are about to decide upon today at the council. And to our development partners who supported this effort variously with their talent, with their time, and with their treasure. So we thank you. A year ago, we started laying out plans and we made decisions. You can say the first year was a year of planning, of preparation, efficacy of health products and the distribution system that we have. There are many efforts that we put in that first pillar of governance that has become inclusive, with civil society, the private sector working hand in hand with us, and other parts of government also working together with us. And I appreciate the members of the armed forces as well who have also contributed in certain areas where we have had outbreaks. On the second pillar, to improve our population health outcome, we still have some tangible results that we can celebrate. The fact that we have had 4 out of the last 8 meetings of the Ministerial Oversight Committee for DHCPR and disbursed 46 billion naira to the more than 8,000 primary healthcare centers in Nigeria on time. I think speaks volume to the cooperation between the federal government and the states. And now we will train 130,000 frontline health workers. We've done more than 43,000 of those, and we're on our path. And that is a testimony to the collective effort between the federal government and the states. We've expanded the medical relief program, tried to provide targeted support to ensure that the poorest and most vulnerable access products when they need them. The revitalization of primary healthcare has been underway, and more will be revitalized. I think we have visibility to almost 4,000 in collaboration with the states. On the human resources policies, we have had the human resources workforce migration policy approved, which was started at the Council of Health, but it's really going a long way in expanding the training of our health workers. Federal government was also states doubling the quotas for medical school pharmacists, nurses, and others. I think there are a lot more that we can mention in terms of learning across the health professions, which we have been able to do. On the affordability side, through the NHIA, the obstetric complication of BVF, but more than 1,000 women already being repaired their obstetric fistula complications free of charge since that initiative was announced. In addition, in effort to reduce the maternal mortality, we know that at least 30 primary healthcare centers, secondary facilities that are able to offer CMO services are being empaneled by the NHIA, and more will be empaneled. By the end of the year, we'll have at least 100, and they will have reimbursement through NHIA to offer these free services for emergencies for women when they face severe complications, including cesarean section. We call on states to actually partner with us. There are so many efforts that are being carried out in the NHIA to expand health insurance through the NHIA, but also with the support of the state health insurance authorities. So collectively, we're beginning to move forward in the agenda that we laid out for ourselves. To expand our healthcare value chain, the third pillar, I think the research and development agenda is well on the way. We have more than 56 business cases, including from companies who had exited Nigeria, who are now looking at how they can reconnect in our market. And we are seeing path to being able to manufacture test kits, pharmaceuticals, biologicals, and assemble medical equipment in our country. That's only in the first 1 year of this overall effort. On health security, I think it's fair to say that collectively, by collaborating between the federal government and states, with the support of our development partners, we've been able to handle so many outbreaks: diphtheria, meningitis, yellow fever, cholera, by working hand in hand together with all of you. And have launched the strategy for genomic surveillance as well as our national action plan on antimicrobial resistance. Those are very tangible things that we have put in place that require all of us to continue to work together to execute. Climate health and health, climate change and health. We were able to do the vulnerability assessment, and I believe that it's one of those key interventions that will help to adapt to the consequences of climate change as we've seen recently in Borno and many other states in our country. And the cross-cutting enablers of digital transformation, we are also making progress in a way that will help transform our health systems by enabling the health facilities have a coherent, standardized medical record system that is interoperable with the infrastructure to support it. It's a long journey, but we have started with that. I want to thank our development partners for chipping in at a time when governments are facing fiscal space constraints to contribute in this effort and being transparent, engaging with us, to learn with us, and to support what we are doing together. As we move forward in the Federal Ministry of Health, this next year, our focus will be first on the quality of care that is being offered in our higher institutions, our teaching hospitals. Yes, we're expanding the infrastructure for cancer. We're expanding the teaching hospitals, the infrastructure, and we have the chief medical directors that are here as well. But this year, we're focusing on the quality of care in our teaching hospitals. And I believe that the scorecard that we developed to track the performance of our teaching hospitals in terms of the quality of care that they offer will be very useful too to drive that change so that we deliver even higher quality services for Nigerians. Secondly, on the affordability, I think the medical relief program that we started this year is going to be expanded so that we ensure that Nigerians who have shared their perspective that the cost of care is an issue, not only through the NHIA to have affordability, but also to have some subsidy mechanism that will allow the cost of medications to be received reduced. I think the point that the Honourable Minister of State raised on industrial harmony is one that is very key to our mind. We're very fortunate that in the last year and a half, we have minimized, preempted, resolved very early on issues that would have resulted in disruption of services. I believe that if we put the Nigerian person at the center of attention, all the professional groups will find it easier to understand why going on strike is not the solution, and that the issues that they have are being resolved by this administration fronted. And we hope that we will continue in that spirit so that we maintain industrial harmony. At the end of the day, our purpose is to improve our population health outcomes, to ensure that we have financial protection and that we protect those who are the poorest and vulnerable in our society. That is the mission that President Bola Ahmed Tinubu gave to us. And we thank state governments and all of you that are here.
Before 2019 election came, we all know what we had gone through in the hands of the monstrous Boko Haram. Thousands of our hospitals were destroyed. Many of our health workers were kidnapped. The situation was generally moody and gloomy. And in this situation, a man came, a man who was thrust upward state by destiny. And the first thing that was done was to begin to work on a 10-point pact for the state. And by 2020, that 10-point agenda had metamorphosed into a 25-year development plan. And health is one of the areas that has the pride of place in that plan. Of course, all other sectors were touched. Professor Biden, in the past 5 years that he has been in government, have received accolades from around the world to the extent that the United Nations Secretary General described him as the best governor in the world. Appreciations, honors continue to be showered on him, including such prestigious awards like the Sikh Leadership Award. And at a point, His Excellency became tired of receiving awards, but he was not the one asking for them. He wanted to identify with Babagana Umar Zulum. In fact, we had states where election was being carried out and the posters of the people running for election has Babagana Umar Zulum. Ladies and gentlemen, permit me now to invite His Excellency the Executive Governor, Professor Babagana Umar Zulum, to kindly address us and after declare this conference open. Your Excellency, sir.
Let's sit down. Is it okay? I can go there. Which one is?
It's okay.
Okay. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. The Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, CON. Dr. Isaac Adekunle Salako, Honorable Minister of State for Health, members of the National Assembly that are here present, Special Advisor to President on Health, on Dr. Salma Anas Kolo, Permanent Secretary, Minister of Health. I can understand the Waziri of Borno, the Executive Director, National Primary Healthcare Development Agency, Executive Secretary, National Sikkim, Miss one very person, the chairman of our great party, APC. Anaji Bello Ayuba, the country director, World Health Organization, the Vice Chancellor, University of Maiduguri, my sister, the Senior Special Assistant to the President, other Vice Chancellors that are here present, the Chief Medical Director of the University of Maiduguri Teaching Hospital, and other Chief Medical Directors that are here, the representatives of development and humanitarian partners, the commissioners of health that are here, permanent secretaries of states government, heads of security agencies, distinguished invited guests, distinguished ladies and gentlemen, is it morning or afternoon? Morning. If you have attentively listened to the speech that was made by the Honorable Minister of Health, you can testify that he knows what he's doing. It is my distinct pleasure to welcome all of you to Maiduguri, the Borno State capital, for the 65th National Council on Health meeting. This unique gathering is a testament to our commitment to improving the health and well-being of every Nigerian, from the bustling cities to the most rural communities. My presence here today is a testament to our unwavering commitment to advancing the health and well-being of all our citizens. We are here because we recognize that health is not merely a sector, but a fundamental pillar for the progress and stability of any society. We are as well reminded of the responsibilities we carry and the great potential we have to transform the health sector across our nation. In Borno State, we are deeply committed to realizing the goals outlined in the Abuja Declaration, which call on every state to allocate at least 15% of their annual budget to health. I'm proud to share that Borno State has taken significant steps towards meeting this commitment. In our recent budget, we have prioritized health infrastructure, increased access to maternal and child health care services, and allocated resources for critical disease control programs. These efforts are part of our broader vision to make healthcare accessible to every resident in Borno State, especially those in hard-to-reach and conflict-affected areas. As we gather here today, I want to address the most pressing health challenges we continue to face, which is the maternal mortality. Despite our dedicated efforts, including the provision of free cesarean sections for those in need, maternal and maternity rates remain high. It is sobering reality that we must confront together, and it underscores the importance of taking decisive and innovative action. The launch of the Maternal Mortality Reduction Initiative by the Federal Ministry of Health aligns directly with our state's dedication to improve maternal health and represent a powerful commitment from the highest levels of our government to make childbirth safer for every woman. Through this initiative, Nigeria aims to eliminate financial barriers to life-saving cesarean procedures, prioritizing support for areas that experience the highest maternal deaths. With the resources and framework provided by these initiatives, we can strengthen our healthcare system by enhancing coverage, improving service quality, and ensuring that every woman has access to skilled care during childbirth, as collaboratively implemented by the National Healthcare Insurance Authority and the National Primary Healthcare Development Agency. This joint effort provides a pivotal opportunity to scale up maternal care across our country and ultimately reduce maternal deaths. As we move forward, let us renew our commitment. Let us renew our commitment to this cause. Continued collaboration between federal and state agencies our dedicated health workers and community leaders are essential if we are to provide safe and equitable health for all. The path ahead may be challenging, but I am confident that together we can transform maternal health outcomes in Nigeria and set an example for the other nations across the globe. In this convention, I want to seize the opportunity to request the Honorable Minister to consider the establishment of a federal medical health center in Borno State to complement our existing health facilities for effective and efficient healthcare delivery systems. I would like to extend my heartfelt gratitude to the Coordinating Minister of Health and Social Welfare for his steadfast support and engagement with us in Borno State. I can recall that within the last 4 months, the Honorable Minister for Health was in Maiduguri, or no fewer than 4 or 5 times. This goes to show how committed he is to the growth and development of the health sector in Nigeria. His continued support across various health initiatives has been instrumental in helping us achieve these results. We also acknowledge his proactive engagement during the recent floods, when he ensured that Borno received essential medical supplies and support to address health needs of those affected. This collaboration has strengthened our resilience and underscored the importance of unity in addressing health crisis. In the history of Nigeria, we have never seen a minister of health that has shown concern to the revitalization of health systems in Nigeria. Let me use this opportunity to commend the National Primary Healthcare Agency, Executive Director, and indeed the Executive Director, Secretary of the National Health Insurance Agency, for the tremendous support that they have been doing towards complementing the efforts of Borno State government in revamping the primary health care systems in the state, in our states. We receive our contribution for our counterpart fundings promptly as at when due. What matters now is not lack of funding, but how we can effectively and judiciously utilize the little resources that we have. I want to assure the Honorable Minister and the Executive Director that inshallah Borno State will ensure judicious utilization of these funds. I want to commend the federal government of Nigeria under the leadership of President Tinubu administration for providing the enabling environment for us to ensure the growth and development of the health sector in Nigeria. And this will never be feasible without the support of the minister. And I'm happy to note that he has gotten another new Minister of State for Health, whom I believe they will work assiduously to ensure success in the healthcare system. Let me also commend our sister, the special advisor to the President on Health. And it is my sincere will that you will partner together with the Minister for the growth and development of the health sector in Nigeria. We also express our proper behaviors by endorsing immunization campaigns, maternal health programs, and sanitation efforts. These leaders have equally significantly increased acceptance and participation in critical health interventions. Furthermore, to my colleagues, the executive governors of state who have demonstrated commendable dedication to advancing healthcare priorities through policies that ensure better funding, infrastructure, and resource allocation for the health sector. On behalf of my colleagues, the governors of the 36 states of the Federal Republic of Nigeria, I want to assure you, Mr. Honorable Minister and your team, that inshallah, we shall provide the necessary support for you to succeed. Additionally, we want to acknowledge the chairman of the Commissioners Forum, whose coordination and advocacy have galvanized our collective efforts towards realizing for the support that they have been providing to our health sector in Borno State especially. I also want to commend EU, USAID, for all the good works that they have been doing. Furthermore, I want to express my sincere appreciation to Bill Gates Foundation, Bill and Melinda Gates Foundation, and Aliko Dangote Foundation for the support that they have been rendering to our PhD systems in Nigeria. Above all, the contributions and support of all the humanitarian partners and the development partners in Borno State need not to be overemphasized. However, I just want to make a very few remarks. The role of the Minister of Health is not only Minister of Health, but also the coordinating Minister of Health. And one of the major problems that we are facing, especially before the arrival of this minister, is in the areas of coordination. Funding is not our major problem, but the coordination of the activities of humanitarian and development partners still remain our biggest challenge. Still remain our biggest challenge, under no without our own consent. This is very important. Under no circumstances, partners should come and work based on top-bottom, produce health for all Nigerians. At this juncture, I also want to direct the Commissioner for Health in Borno State, and indeed the head of service, to link up with the Minister of Budget and ensure that there is no disparity between salaries of the federal health workers and that of the state. One of the problems that we are facing in Borno State, I realized, was the disparity in salaries of medical doctors from working in the federal institutions and indeed from the state institutions. This is our major challenge. Migration of medical doctors from state hospitals to federal institutions is a matter of great concern to all of us. Although Professor Aija is my good friend, he's always taking my doctors from the state hospital. And therefore, as from December 1, medical doctors from Borno State government will enjoy the same salaries. Just last week, I released about 301 million naira to support about 100 medical doctors that are serving in the state health institutions who are undergoing residency training. In addition to this, I also released 1 million naira to all indigents of Borno State that are working in this University of Maiduguri Teaching Hospital and other health institutions across the nation that are serving the residency training. We shall continue to motivate the health workers, continue to provide houses for them, and very soon we shall also provide furniture allowances and others to the medical doctors. Finally, today's gathering reaffirms our collective dedication to a healthier Nigeria. Let us work together with renewed commitment, ensuring that healthcare reaches every corner of this country. At this juncture, I hereby declare the 65th National Council of Health meeting open for deliberation here in Maiduguri to the glory of God. Assalamu alaikum.
Yes, we need to do a standing ovation. A standing ovation, especially Borno State health workers. The salary just got upgraded, and every other thing you have been looking for, His Excellency the Executive Governor just gave approvals without any other consideration. Can we give another round of applause to His Excellency? Thank you, Your Excellency. We have gone this far. Please let us take our seats. Let us take our seats. We have gone this far and we are about to rounding up now. But before we round up, we are going to take a vote of thanks. And I'd like to invite the Permanent Secretary Health, Federal Ministry of Health and Social Welfare, Daju Kacholome MNI, to kindly come for the closing remarks, the vote of thanks.
I'm looking for one.
Your Excellency, the Executive Governor of Borno State, Professor Babagana Umar Zulu, CON, MNI, FNSE, the People's Governor, the Compassionate Governor, and the latest one, the best governor in the world. Your Excellency, sir, I stand before you all this afternoon to give a vote of thanks. My job has already been done, but I will still do it because the coordinating minister has thanked everybody. The governor, His Excellency, has thanked everybody. But it is my job officially to thank you all for coming. Permit me, Your Excellency, sir, to first thank you for agreeing a year ago to host the National Council on Health in Borno State. And secondly, to thank you for indeed being the home of hospitality. Since we arrived in Borno on Sunday, even prior to that, Your Excellency, sir, it has been a warm, enchanting, and hospitable time. I want to sincerely thank you on behalf of the coordinating minister, Minister of State, and the entire staff of the Federal Ministry of Health. And thirdly, sir, Your Excellency, you just made a fantastic declaration, increasing, directing that the salaries, the disparity of medical doctors, the salaries will increase. We are very grateful, Your Excellency. Permit me to add, Your Excellency, my minister has not directed. It is my concern, Your Excellency, that we thank you on kindly look into all health workforce, not just I think that all kinds of sincerity based on the other health workforce that we have, so that you have a serious health workforce system in Borno, which is when the MP was talking, he spoke about minister as an average administrator of technical. What is the one something else? We do the rationale. And we have all license for those who don't know. It is a cheapery. It doesn't care. It doesn't doubt. And it doesn't doubt. In Nigeria, alongside our dear honorable minister of state, and those who don't know, is a certified COVID and tomorrow. And yes, they will and are ready. Yes, it is news about national care colleagues, friends, members of the parents. It is my pleasure to go to Venezuela. Association. And this thing will reflect the needs of the new corporate agenda, as well as the Nigerian Sector Renewable Investment Initiative. And I also want to recognize and thank the President of Africa, as well as the Chairman of the local government case yesterday held a meeting at the timeline of the National Council on revitalizing primary healthcare centers in Nigeria. We want to acknowledge you and say thank you very much for aligning with the mandate and what we are doing in the Federal Ministry of Health, because without the local government where the primary healthcare centers are, the first port of call communities, we cannot especially do anything. Because from you to the secondary, then you refer to the tertiary. We thank you all for coming. Permit me to appreciate all our participants during the technical session that especially the state permanent secretary, executive secretaries of the state health insurance and primary healthcare development agencies, state directors of planning and statistics, the development practices. Your contributions were insightful and motivating. Above all, my sincere thanks goes to my dear directors of the Federal Ministry of Health and those of the agencies who are quite a number of you of our federal agencies and the ministerial, our CND, Committee of CNDs and NGOs. Without you, we will not be here. Your Excellency, distinguished ladies and gentlemen, I would like to thank Dr. Wilson, the WHO Commissioner, for saving the moment and being interpreted as the Director General. I would like to suggest that as we sit here, let's think about Nigeria. We are surrounded by our friends, neighbors, our brothers and sisters. I believe we should let them speak in French language. Thank you and be very much.
Thank you. Family Secretary, Federal Ministry of Health, this is how far we are doing this morning. Before we run to the we have to take 3 pictures before the next session. The first one will be then the next, all the commissioners of the process will join them. And the last one, members of the organizing committee, national and local. So photographers. No. I've just been told that our revered traditional rulers need to take pictures of the item. Can I most respectfully invite the Shehu of Dukwa to lead all the traditional rulers that are here to come to the item and have a photo session with His Excellency the Executive Governor, the ministers, and the special advisor on health to the president. Photographers, we need to. Traditional rulers first. Photographers, we have our traditional rulers lined up. Can you do what you need to do? Are you through with the pictures? Thank you. Can I have the Honorable Commissioner of Health, Borno State, lead all his colleagues, Honorable Commissioners of Health, can they come to the podium and have a photo session with His Excellency and the Honorable Minister? Honorable Commissioners of Health, can they come to the item? And while they are coming, members of the organizing committee, get ready. You will come up here. Dr. Abba Jato Kaza, please get the other members ready. Immediately after, the commissioners will take you.
It's the one that is bringing me up there. He comes to carry me.
Let me remove this mic. This guy,
The representative of the chairman on the health, please, Dr. Midela Umar, please come up. Executive Director. So let's take the commissioners, His Excellency and the Honorable Minister. And when they are done, we call the chairman of the House Committee on Health, representing the SA to the President of Public Health, Dr. Mrs. Uju Okorocha, and the two executive directors and the Vice Chancellor of the University of Maiduguri. We are in your premises and we need you in this picture. Commissioners, thank you. Commissioners, thank you. Where are the executive secretary and the representative of the chairman House Committee, the special assistant of public health? Commissioners, please kindly come down. Commissioners, kindly come down. Where are the members of the organizing committee?